Back with you talking about all things health insurance and Medicare. Catherine CVA from AARP, Steve Edmonds from Alliance Insurance Services. All right, so Steve, this person says, can you return to traditional Medicare if you don't want to continue in an Advantage plan?
You can. Yes, you can cancel your Medicare Advantage plan and return to traditional Medicare. Keep in mind when you do that your Medicare Part B is only 80% coverage. That means you're going to owe the other 20%, and there's no stop loss or there's no out-of-pocket max on that 20% with Medicare. So again, that might not be the best thing, but you certainly can do that. Yes.
Okay. Catherine, this person says, when I chose United Healthcare AARP Medicare, I was told I would never need my red, white, and blue Medicare card. I've had two people, though, tell me that's not true.
You need to have your Medicare card because those are two different plans. And should you ever change from the United plan to another one, you would have to make sure that the two things are joined together and your Medicare number is different from your insurance number.
Okay, good to know. This person says, I'm on disability. I've sent my Medicare card effective 7/1 of this year. I heard the Medicare Advantage plans are not good coverage. Can I simply stay on my husband's employer's insurance as my supplement, or am I better off to get a private supplement plan?
Okay, so the Medicare Advantage plans can be really good. So first of all, it's according to the plan, but a lot of those are really good plans. Secondly, yes, you can stay on your husband's coverage as long as it's credible coverage. Most of the time, if he's working for a company with more than 20 employees, most of the time that coverage is credible. But to Catherine's point a while ago, you need to check with HR and make sure it's a credible plan. You can do that, but if you're going to do that, you need to defer Part B. Because why pay a Part B premium if you're on your husband's insurance plan? But here's the main thing. I would check my husband's insurance plan to see what is his deductibles and what is his annual out-of-pocket maximum under that group plan. Because a lot of times these Medicare Advantage plans are so good, your max out-of-pocket on those probably won't exceed $3,500, $3,600 a year. So a lot of times they would be the better choice.
Okay. Catherine, this person says, if I took Social Security at 62, am I automatically enrolled in Medicare?
No, you are not. They are, even though they're both government plans, you have to enroll in Medicare separately when you turn 65, 3 months before to 3 months after.
Okay. This person says, my wife has never worked. Does she buy Medicare Part A? What does that cost?
So she's never worked, so that means she probably doesn't have enough quarters paid in to qualify for the Medicare coverage.
Okay, gotcha. So she would have to do like the marketplace insurance coverage for insurance then?
She could possibly do that, but you have to have, I think, Catherine, you might correct me on this, but I think it's 40 quarters paid in during adult working life to qualify for Medicare.
It is for Social Security, and I think she would have to call them and check and see what the rules are about that.
All right, Catherine, this person says, should I trust the calls that I receive saying I may be eligible for more Medicare benefits?
I would never trust the calls that you get that are soliciting you, and I certainly wouldn't give them my Social Security number, my Medicare number, or any of that. If Social Security or Medicare want to talk with you, you can offer to this person that's calling you, I will call them directly myself and inquire from your side so that you're not at risk for scamming.
Okay. Steve, this person says, if you're at the age to start Medicare but still working and have eligible health care at your job, can you start using Medicare in place of your work plan? My work plan is expensive.
Yes, you can, and that kind of reverts back to the question we answered a second ago. You always want to compare what your deductibles and your out-of-pocket maximums are on those work or group plans. Sometimes they're very, very high, and a lot of times the Medicare plans will have much lower out-of-pocket expenses there. But, you know, you can stay on a group plan for sure if you're still working, absolutely.
Okay, and real quick if we can, what is Plan F?
Plan F is a Medicare supplement. Some people call that Medigap. Plan F, the federal government decided that we were going to stop selling those back in 2020. But if you had one prior to that, you can keep it. They're not going to take it away from you. But Plan G would now be the go-to plan most of the time on a Medigap policy instead of Plan F.
Okay, we answered a lot of questions, and there's still probably like 30 questions more that we could answer. So, of course, we'll be talking to you guys again next month as we try and get as many questions answered. If there's anything that you may have missed or you want to hear again, we'll be posting this interview in the Who Wants to Know section of our website.